Welcome to Kids Doc Talk with Ask Dr. Jennie. Today's guest is Dr. Matthew Uhde talking to us about sun safety. Dr. Uhde grew up outside of Chicago in Wilmette, Illinois. He earned his Bachelor of Arts degree at the University of San Diego, Master of Clinical Medical Science degree at Barry University, and received his Doctor of Osteopathic Medicine degree at Nova Southeastern University, graduating with highest honors. After training at JFK Medical Center in internal medicine, he completed his dermatology training at West Palm Beach VA Medical Center and served as chief resident for both his internal medicine and dermatology programs. Dr. Uhde obtained dual board certification by the American Osteopathic Board of Internal Medicine and the American Osteopathic Board of Dermatology. Dr. Uhde has presented posters, given lectures, and published articles on various dermatology topics in research within the professional medical community. He is the clinical investigator on multiple dermatologic trials through his office at Palm Beach Dermatology Group in Delray Beach, Florida. He has received numerous awards and recognition throughout his medical school and postgraduate years, including the Nova Southeastern University College of Osteopathic Medicine's Dean Community Service Award and induction into the Sigma Sigma Phi Sigma Alpha, and Gold Humanism Honor Societies. Welcome, Dr. Uhde.
Welcome to Kids Doc Talk with Dr. Jennie. Dr. Jennie is a board-certified pediatrician and is the Director of Telemedicine at Pediatric Associates.
Hi, Dr. Uhde, welcome. Thanks so much for joining us.
Thank you for having me. Pleasant to be here.
Good. So I want to start by talking a little bit about sunscreen, and we get tons and tons of questions about sunscreen safety and all sorts of things about what we're supposed to be doing with kids who are out in the sun, especially Florida babies and Florida kids. So Let's start with age. What age do you normally recommend daily sunscreen wear?
So the age issue, we say 6 months. That is our general recommendation. And there's a reason behind that 6 months. It's that in reality, we should not be having babies in the sun who are younger than 6 months because of not just the sun exposure, but their little bodies, and they get dehydrated very easily. They get overheated very easily. So the sun in general makes them overheated. And so it's more of a recommendation of not to have your children, babies under 6 months of age, in the sun. If you are going to be outside, it is best to be in a shaded area, have lightweight, breathable clothing that covers their entire body, along with a large, wide-brimmed hat, which I'll probably say over and over again, as much protection as possible to not get overheated.
So it's not that there's anything inherently unsafe about putting sunscreen on babies who are younger than 6 months, right?
No, there is an issue that young babies have sensitivities to their skin more than when you get older. And the issue that we find is that when you put sunscreens on a 2-month-old, 3-month-old, is that it irritates them. They get rashes very easily, and they have a lot of reactions. Now, whether or not they'll have those reactions when they get older remains to be seen, but they'll less likely have a reaction greater than 6 months than if they were younger.
That makes sense. So a lot of times I get questions on best sunscreen, like what's my favorite sunscreen? What sunscreen do I recommend? My general answer is whichever cheapest one you can find with the highest SPF. I'm starting to think that maybe that's not the right answer. So tell me a little bit about what should that answer be, at least in terms of the SPF. Is it better just to go as high as you can, or should we have more nuanced guidelines?
This is a great question because we get comments and questions like this all the time in my office. And I think to better understand this, it's good to kind of explain what is this SPF and what are we aiming for here. So SPF stands for sun protection factor. It's the amount of solar UV radiation through the skies that gets exposed on an individual, and then with no sun protection. Therefore, it's how fast do you get burned. So someone who walks out in the sun with no protection they get burned after X amount of minutes. So the SPF is the sun protection factor, allows us to stay out in the sun longer without getting burned. So when we talk about exposure, and SPF, it's good to know that we're not just talking about length of time in the sun. We're talking about what kind of exposure you're getting. So the sun is the most intense between 10 and 12. That's when it's the highest in the sky. That's when it's getting the most radiation through and to our skin. So if you are outside in the sun around 4 o'clock versus 12 o'clock, you're getting more exposure at 12 o'clock versus 4 o'clock. In fact, you're getting 4 times the exposure. So if you're 15 minutes in the sun at 12 o'clock, that's going to equal 2 hours at 4 o'clock. So along with this exposure we're talking about and the intensity, we're also talking about what kind of skin type do you have. So the more darker complexion you are, the more natural protection you have, and the more resistive you are to that UV radiation. So there are a number of factors here involved that kind of lead to the SPF. And more SPF.
That's super interesting, but I'm thinking that as a parent, right, if I'm going on in the store and I'm looking at all the different sunscreens, and let's say even I understand my kids' skin sensitivities, and I understand that, my kids are light skinned, so likely to burn a little bit faster. I feel like I'm still just going to err on the side of caution and just go for the one with the highest number. Is that correct? Is that a normal strategy?
So here's a funny thing with that. It is a good strategy in the end, and I'm going to tell you why. It's because of Consumer Reports, that lovely organization who has tested everything from vacuums to chewing gum. So of course, every year they test sunscreens. And what they have found was, surprise, surprise, they're not what is advertised. So a sunscreen that says SPF 50 is actually SPF 20. So I recommend at least a minimum of 30 SPF, preferably 50. And the real reason is that I can't guarantee what's on the label is actually what you're getting. Now, there is data that does show that when you look at SPF in terms of how high the SPF is and the length of time that it takes to get burned with having the higher SPF, it's a logarithmic type graph, in the sense that if you go from 35 to 50, there isn't that much difference in terms of protection you're getting, maybe a few percentage points. Obviously, that matters in terms of skin cancer. I mean, the more percentage points you get, the better. But in reality, you're not getting that much more coverage between a 30 and a 50. But the problem is that since the FDA doesn't regulate these products like prescription medications, you're better off just going for the higher SPF. And I think 50 and above is the goal here.
Okay, that makes sense. So I feel a little better about looking for the 100 on the bottles, which may be a little bit extreme, but based on what you're saying, that 100 probably isn't even a real 100.
No,
sort of like 60 or 70.
At least you're getting the protection that you need.
Makes sense. Okay, so that's a lot of information about SPF. Tell me a little bit about the different types of sunscreens, because I know even looking at the SPF isn't necessarily the only factor, right? There's different kinds. So what is chemical sunscreen? Let's start with that.
Okay, so right, there's two main types. So we have chemical and physical. So we'll talk about the chemical sunscreens. And what that means is there are certain chemicals and they absorb the sunshine. They absorb the UV rays so it doesn't get into your body. So, which is different from a physical blocker, which actually blocks the rays from entering in. There is, if we're talking about chemical sunscreens, there is some issues with this that's been the news in the last couple of years. In 2020, they did a study. Weren't that many patients, but they did a study and they took various sunscreens with the different chemicals on them, only chemical sunscreens. And they put them on patients, left them on there for a typical amount of time to reapply every couple hours. They did it for multiple days in a row. They took people's blood at the beginning and at the end of the study, and they wanted to know what the plasma concentration was of some of these chemicals they found. Were they positive in the blood or not?
So
And
basically looking at whether or not the sunscreen got absorbed, right? Which presumably we don't want, right? We want that number to be very low.
Exactly. So unfortunately, they found 6 ingredients that were found in low concentrations in the blood, but over the, I guess, threshold of tolerability. The problem is that we don't know what that means. Certain chemicals we know cause cancers or cause issues. These we're not sure of. The jury's out still. We don't know if this does anything or not. And there's, again, 6 ones they found. I'm going to mention just a couple: avibenzone, oxybenzone. Oxybenzone to come up, I'm sure, in more things we'll discuss later. But many of these sunscreens now, the manufacturers are taking some of those ingredients away and staying oxybenzone free or certain of these chemicals free. So it's difficult because I do understand some of these do get absorbed, but the question is this actually doing anything or not to us?
So do you typically stay away from recommending chemical sunscreens because of this potential risk, or you're not so convinced that this matters at all?
Well, it gets the problem is that we have to talk about physical sunscreens too, just for a second, because this is why it matters. Yeah. The chemical sunscreens go on very easily. They go on very smoothly. They blend right in. You can't even tell you're wearing sunscreen. Right. Maybe you have a little glitter, but you can't really tell. The physical blockers, which are made of metals, titanium, zinc, or iron oxide, actually block the sun rays, but they can appear like a ghost white onto people. You see that kind of thick paste? That's the physical sunscreen. They're fantastic, but they look like you got sunscreen on you. So it's not the best cosmetic look. And so people want something that looks better, which is why they choose the chemicals. So beyond the vanity aspect of it, it's hard for me to say just don't do chemicals, but I am recommending to patients to stick with the physical blockers because of this unknown factor right now.
I think that's really important. And that makes me think of like conversations we have about anything in medicine, vaccines, or different medications. Like, we're not necessarily talking about the risks of sunscreen versus the risk of no sunscreen. We're talking about the risk of sunscreen against, right, the risks of damage from the sun, things like skin cancer, right? Presumably what we want to avoid, especially in children. So I think it makes sense to have some degree of risk tolerance. Also makes sense to look at it as probably trying to minimize whatever harmful effects of sunscreen, and definitely err on the side of caution.
Yes. Unfortunately, melanoma is still a horrible skin cancer. And if you can prevent it, the UV rays definitely cause melanoma. We don't know what's the chemical sunscreen and what it can do to us.
Makes sense. Okay, so moving away from I think good covered sunscreen, probably the other side of that spectrum is like spray sunscreens, right? So I have little kids, right? They're active, they're running around. And so when I think of desperate times, I always think of spray sunscreen. And then I tell myself, well, it's something, right? I know it's not so great, but it's something. Is there any evidence that spray sunscreens are helpful? Are they doing anything, or am I just kind of kidding myself?
So sunscreens spray sunscreens, they're so easy. And I get it. You have a little one, they're slippery, still, the old, the joke is it's like wrestling an alligator. You can barely get it. So obviously a moving target, spraying is a lot easier to chase around the house than with a handful of lotion flapping legs. It's hard. I understand. The problem is that moving targets is that the sunscreens don't do an even coat. Mm-hmm. And they don't get everything equally. Unlike the lotions and the creams, you're putting it on manually and you're getting it everywhere. With the spray, it's a mist hitting the skin and there's a lot of uneven coverage. So you're not getting adequate protection. Now, I'll take what I can get. If patients only say, I'm only going to use this, fine. At least you're getting something covered on you. But I do want to stress it is not the same as good old-fashioned lotions and creams. You don't get the same protection. And then, of course, there's always another curveball. And another study that came out recently this year, last year, stated that these spray sunscreens have benzene in them. And there's a new push to avoid any sunscreens with benzene in them. And we know that benzene is definitely a carcinogenic. Now, it's not an actual ingredient in the sunscreen where they're finding it's a manufacturing process. What is interesting, there was a research company called Valisure that did an independent analysis of 100 plus sunscreens. And unfortunately, in a lot of them, in 70 plus products, they found this benzene in bad levels, basically, in the bloodstream. They found that over a dozen of them had severe bad abnormalities. Now, the issue was, of all these severe bad benzene levels they were finding being detected in the sunscreens, all these were spray sunscreens. There were some spray sunscreens tested that didn't have the benzene in them, but all the ones that had the bad levels were found to be spray. So unfortunately, I am telling my patients, we should probably not be using the spray sunscreens because there might be this contamination of benzene. We know that is a carcinogenic, therefore we shouldn't be using them. Now, if you do go to an internet browser and you type in the Valisure benzene sunscreens, you'll get a hit and a list of the sunscreens they tested and which ones they found that had the benzene and which ones didn't have it. So you can find some spray sunscreens without it. And I'm pretty sure that over time, the manufacturing process will change, that will take the benzene out of these products that had them, and it won't be an issue in the foreseeable future.
I think you make a pretty good case in the meantime, to avoid spray sunscreens for not only the potential carcinogenic issue, but also their what sounds like lack of quality coverage. So I think I feel good walking away with with that being recommendations. I think I have a pretty good understanding now of like sunscreens and kind of sun safety. I want to shift gears a little bit and talk about other causes of rashes in kids. So, working on telemedicine and general pediatrics, we see tons and tons of rashes. I think one of the biggest concerns sometimes that parents have are like, what is not only not knowing what it is, but could this possibly be an emergency? As far as I know, very, very few causes of true emergent skin rashes in kids. But tell me, is that kind of a thing also I fool myself with, or should I have some higher up on my list of differentials? So
sunscreens in general can cause rashes in kids. And that oxybenzo I mentioned earlier is one of these particular ones. In fact, it was the allergy of the year some years ago. And a lot of products have taken it out. But there are other ingredients, preservatives, fragrances, that could also cause a contact dermatitis. The fortunate thing is that a lot of these are very treatable with a steroid medication. You should see your pediatrician or your dermatologist if this occurs, you get the appropriate medication. The only other complication with this is that those that break down that skin can lead to other bacterial infections. So it is good to see a medical provider or physician to look at that rash and also make sure it's a contact allergy versus something else.
What about other causes of rashes that may be emergent? Is that ever a thing in pediatrics?
So for sunscreens in general, I wouldn't call it an emergency unless there was a secondary bacterial infection where they had an infection like a cellulitis skin infection involved with it. They don't really cause annoyances, but treatable. And you would need to try to do treatment sooner than later, but it wouldn't be a reason to go to the ER that night unless their child wasn't feeling well on top of it. Then I'd worry about a secondary infection where they would need more of an immediate treatment.
Is there ever, as far as you know, is there ever a time for somebody to be taken to the ER for a skin complaint, exclusively a skin complaint?
So branching outside of the sunscreens, when should we worry about emergency for skin issues, especially in pediatric patients? I mean, there are certain conditions. A lot of these have to do with infections, viral infections, bacterial infections, abscesses, the quote unquote spider bite, which causes localized infections. By the way, they're not really spider bites, they're just localized folliculitis infections, but everybody has this thing in their minds that there are these evil spiders out there getting us, but that's not really the case. I mean, there are spiders that cause issues, but not in the degree that people complain about them. And there are certain unusual skin conditions that are emergent, but that's a very obvious sign. That means head to toe redness, peeling, some unusual conditions that are more emergent.
I think that's what it kind of I was thinking about. Like when we think of, for example, Stephen Johnson's, right? That's the one that always comes to mind when we think about dermatologic emergencies. I think at least the ones I've seen, like head to toe skin sloughing, right? Right, we're losing that protective barrier of skin, and we start to think about dehydration, the pain that comes along with it, etc. Is that pretty much it? Is that kind of a pretty short list of true skin emergencies?
Exactly. So the one bonus of my field is that I don't really have too many true emergencies. So again, Stephen Johnson's exact example of this, toxic epidermal necrosis, they call it 10, is a severe form of Stephen Johnson's. There are a couple of these blistering conditions that could be more emergent, but these are not common. These are rare and don't happen less often in the pediatric population compared to the adult population.
Okay, good. So that's good. At least for us, that's good. Anything that you want parents to kind of know, or any major takeaway points? We covered, I think, a lot of really fantastic sun safety, but what would be your main takeaway that you want to make sure that we're applying to pediatric skin?
Well, it's all about applying, exactly. It's important because we have to think about one, once you put sunscreen on, it doesn't last the entire day. It only lasts for 2 hours and you have to reapply. And then if you're out playing sports, if you're sweating, if you're in the water, if you're in the snow, if you're any sort of something that can wipe the sunscreen off, you're gonna have to reapply sooner. So again, this SPF is only protecting you for that short period of time before you have to reapply again. That's very important. The second one is no matter what pigmentation you have, you always need sunscreen. Even African Americans can burn. It may take them longer to burn than a very light-skinned individual, but they can burn still. So if you're going to be out in the sun for an extended period of time, you need to wear sunscreen. Now, not only are we trying to prevent skin cancers, and again, any race, any person, any pigmentation could develop a type of skin cancer, but the more vain approach to it is that it reduces aging. When you have protecting your skin from the sun, you don't have those UV damage to the skin, causing early wrinkling, early spots and dots, breakdown of the skin just from the UV radiation process. So by using sunblock, you're actually having it sort of your own daily anti-aging cream.
I love that. I think that's really important. Now, one kind of follow-up question, because you mentioned skin cancer. So obviously as a dermatologist, that's your big thing that you're always trying to prevent. I think for parents, it's hard to think about that because it's such an unusual thing for us to see in pediatrics. So out of curiosity, maybe even to drive it home, what's the youngest patient that you've seen with skin cancer?
Well, there are genetic syndromes that cause skin cancers. They're not very common. They cause some basal cell carcinomas, squamous cell carcinomas, and melanoma being the major ones. But again, that's not common. Although I have seen just a single lesion alone on a individual as young as 17.
Wow.
Generally, I don't start seeing a lot of skin cancers until you hit the third decade of life, and then especially fourth and fifth is when you really start seeing it. But if those people who are more prone to getting very light skinned and don't wear sunscreen, you will definitely get skin cancers earlier than you get sun protection.
Wow. Okay. So, I mean, that's really important. So, really, really helpful. Thank you so much. This was amazing. I learned so much. And I think I feel like I have a lot more tools to advise parents on appropriate choice and the correct choice of sunscreen, and better suggestions for how we can get the optimal, safe, right, sun safety. Absolutely. And enjoy the sun, especially here in beautiful Florida.
I would say I have one more just pearl for parents at home. Treatment of sunburn. So if unfortunately your child does develop sunburn, the key is getting moisturizers on them as quickly as possible and as often as possible. Aloe is great, regular moisturizers are great, and you can always use an over-the-counter cortisone cream, a hydrocortisone cream. You can buy a grocery store or pharmacy that's over the counter. You can use that will help decrease inflammation and help decrease the discomfort of your child. Works fantastic.
I also sometimes worry about hydration with these kids, depending on the extent of the burn. So sometimes we'll say increase fluids, and then obviously Motrin, Tylenol, things like that for pain.
The pain, the anti-inflammatories of Motrin, ibuprofen are fantastic. Increasing their fluid intake absolutely is a must.
Awesome. Well, thank you again. Thank you so much for your time, and thank you for these great tips.
Great being here. Thank you for having me.
Make sure you like us on Facebook and follow us on Instagram and Twitter. Thank you for joining us on Kids Doc Talk.